Hello guys, and welcome to our first class of behavioral sciences. Let's begin. Schizophrenia is a chronic, debilitating mental disorder characterized by periods of loss of touch with reality, persistent disturbances of thought, behavior, appearance, and speech, abnormal affect, and social withdrawal. The word schizophrenia translates roughly as splitting of the mind from the Greek words schizin, which means to split, and phren, which means mind. From the first recorded case in 1797 and until today, the way schizophrenia has been understood and categorized has changed greatly. It used to be associated with split personality by the general population until split personality became its own disorder called multiple personality disorder, and nowadays dissociative identity disorder. Many efforts have been made to reduce the stigma that is attached to this disorder, and discrimination and violation of human rights of schizophrenia patients are common. Schizophrenia has been portrayed many times in the cinema, with some portrayals being more successful and accurate.
Charles was watching him. He was okay.
No one here!
Charles was
There's
watching
no
him.
one here!
He's been injected with a cloaking serum. I can see him because of a chemical that was released into my bloodstream when my implant dissolved.
Than others. Research has not identified one single factor responsible for the development of schizophrenia. It's believed that an interaction between genes and environmental factor are the source. Psychosocial factors such as poverty and homelessness may also contribute. Generally, the symptoms presented in schizophrenia can be categorized into positive and negative symptoms. Positive symptoms are things that are additional to expected behavior, such as delusions, hallucinations, agitation, and talkativeness. Negative symptoms are things that are missing from expected behavior, such as lack of motivation, social withdrawal, flattened affect, poor grooming, and poor speech content. These classifications can be useful in tailoring treatment since they react differently to the different types of antipsychotic agents, which we will discuss separately. The different subtypes are as follows. Disorganized schizophrenia is where patients appear confused and incoherent, there's inappropriate emotional responses, and poor grooming. Catatonic schizophrenia is where patients can be physically immobile or unable to speak. It is rare since the introduction of antipsychotics. Paranoid schizophrenia is where someone feels they are being persecuted or spied on. Undifferentiated schizophrenia is when the patient shows characteristics of more than one subtype. Residual schizophrenia is where psychotic symptoms are markedly diminished or no longer present. Schizophrenia has three phases: prodromal, active, and residual. Prodromal symptoms occur before the first psychotic episode and manifest as physical complaints, avoidance of social activities, and etc. Active phase, or psychotic phase, is when the patient has already lost touch with reality. It manifests with disorders of thought content and processes, perception, and etc. The residual phase is the time in between psychotic episodes in which the patient is back in touch with reality but still does not behave normally, typically manifested by negative symptoms. Schizophrenia usually involves repeated psychotic episodes and a chronic downhill course over the years. The illness most often stabilizes in midlife. Suicide is common in patients with schizophrenia, with over 50% of patients attempting suicide. 10% of them succeed. Treatment with medicines and psychosocial support is effective, but sadly the majority of patients do not have access to treatment. Old-style mental hospitals have not only proven to be non-efficient, they have even shown evidence of abuse and violation of human rights.